Remember, just a few days ago, I put out a video and I told all that the moment America begins to relax the lockdown on its states, that there's going to be a psychological liberation across the world, especially around Africa. It has already started happening. Remember that about a week ago, Dr. Jerome Adams, American Surgeon General, had actually dumped the World Health Organization's predictive contagion model, and they decided to work with original data. It appears here from this address of the Ghanaian president that they have actually been using their own data generated by Ghanaian professionals.
Fellow Ghanaians, good evening. Today, Sunday, 19th April, is exactly 3 weeks since I came to you and announced the imposition of restrictions to movement in the Greater Accra metropolitan area and Kaswa, and the Greater Kumasi metropolitan area and its contiguous districts. I explained at the time that the decision was taken to give government the opportunity to try to contain the spread of the virus, scale up effectively the tracing of persons who had come into contact with infected persons, test them for the virus, and if necessary, quarantine and isolate them for treatment, should they prove to be positive for the virus. The decision to restrict movement has occasioned a number of severe difficulties for all of us across the country, especially for the poor and vulnerable, and not only for those resident in the affected areas. Let me express my gratitude to all of you for bearing with government, all health workers, and with members of our security services throughout this period. I requested all of us to sacrifice for our collective good, and we have been doing just that. I thank all our healthcare workers, the men and women of our security services, and members of the media for the work they've been doing in helping to combat the spread of the virus. Let me also thank the individuals and organizations who have made contributions to COVID-19 National Trust Fund. It is truly appreciated. Fellow Ghanaians, since the first 2 cases of infections were recorded on our shores, we have to date traced some 86,000 contacts, out of which we have test results of 68,591 contacts. There is thus a backlog of some 18,000 tests whose results are yet to be received. The overwhelming majority of these contacts have been established in the last 3 weeks of the partial lockdown in Accra and Kumasi. Out of this number, 1,042 persons, i.e. 1.5%, have been confirmed as positive, with 67,549, i.e. 98.5%, testing negative. 99 persons have recovered and have been discharged, and 930 persons who have been isolated are responding to treatment either in their homes or in treatment facilities. These 930 persons, after their treatment, will soon undergo the mandatory 2 tests to determine if they have also recovered from the virus or otherwise. The main reason our country has seen an increase in the number of confirmed cases over the last 3 weeks is because of the decision we took aggressively to trace and test contacts of infected persons. This has enabled us to identify and isolate infected persons, protect the population from further infections, and contain better the spread of the virus. Indeed, Ghana is the only other country in Africa to have conducted more than 60,000 tests, and we are ranked number 1 in Africa in administering of tests per million people. The decision to impose restrictions on movement was backed by the data at hand, And our next course of action, again, is backed by data and by science. Indeed, all that government is doing is intended to achieve 5 key objectives: limit and stop the importation of the virus, contain its spread, provide adequate care for the sick, limit the impact of the virus on social and economic life, and inspire the expansion of our domestic capability and deepen our self-reliance. It is important to state at the very outset that scientists at the University of Ghana have successfully sequenced genomes of the virus responsible for the COVID-19 pandemic, obtaining important information about the genetic composition of viral strains in 15 of the confirmed cases in Ghana. This is a significant milestone in Ghana's response to the pandemic, as it will strengthen surveillance for tracking mutations of the virus and in the tracing of the sources of community infections in people with no known contact with confirmed cases. The Ghanaian scientific community is to be warmly applauded for this advance and contribution to global knowledge. Their work makes us proud to be Ghanaians, and who knows, God may work through them to discover a vaccine. What a triumph that would be. Indeed, the recent genomic characterization of African coronaviruses by our own scientists illustrates the need to establish the enabling framework for sustaining vaccine manufacturing in Africa. We must advance African-led partnerships to drive scientific innovations for the control of viral diseases by vaccination. Ghana, recognizing this critical public health tool, will support the African Vaccine Manufacturing Initiative, which is chaired by Nogushi's Professor William Ampofu, to promote the agenda for vaccine development and manufacturing in Africa by Africans for the world. Government has also introduced the use of drones to expedite the transportation of samples to laboratory centers. On Friday, 17th April, for example, 51 samples were delivered from the Ominako Drone Distribution Center to Noguchi. Furthermore, we're introducing rapid results testing to augment our surveillance and enhance contact tracing efforts so that we can quickly isolate and treat confirmed cases. From the 68,591 samples tested, we've been able to understand better the dynamism of the virus, mapped out its geographic footprint, and established current and potential hotspots. We've also been able to isolate and educate asymptomatic carriers and thereby help minimize the spread of the virus. So far, it has been established that the virus was imported into our midst from foreign shores and is being spread through person-to-person contact. The majority of persons infected in Ghana have mild to no symptoms at all, whilst a very small number have required hospital treatment, of which 9 persons with underlying ailments have died. Towards treatment, we've expanded and added to our network of COVID-19 treatment centers, with the Ghana East and Bank of Ghana hospitals being 100% dedicated to the fight. In addition, we have set aside separate COVID-19 treatment centers at the University of Ghana Medical School, Hospital, the Kolebu Teaching Hospital, Komfo-Anokye Teaching Hospital, Kumasi South Hospital, and in other designated regional and district hospitals. Last Friday, I was honored to do the virtual sod-cutting ceremony for the construction of a 100-bed infectious disease and isolation facility at the Ghana East Municipal Hospital, which is being funded through a public-private partnership under the leadership of the Ghana COVID-19 Private Sector Fund, and whose construction with the assistance of the 48th Engineer Regiment of the Ghana Armed Forces, will be completed in 6 weeks. Members of the private sector fund have indeed acted like citizens and not spectators in these testing times for our country, and their patriotism is to be loudly praised. We have also scaled up the domestic production of personal protective equipment, and our health care facilities so far have taken delivery of 14,550 scrubs, 11,900 gowns, 19,980 head covers, 263,281 nose masks, 13,002 N95 nose masks, 41,117 varying sizes of sanitizers have also been produced locally and delivered to our health facilities. The enhancement of our capacity to test has been made possible by the dedication of the expanded teams at Noguchi Memorial Institute for Medical Research, the Kumasi Center for Collaborative Research, and the National Public Health Reference Laboratory. Further, we're making significant investments in the laboratories of the Veterinary Laboratory, Accra, the Center for Scientific and Industrial Research Laboratory in Accra, the Police Hospital, the 37 Military Hospital, the University of Health and Allied Sciences in Ho, the Veterinary Services Department in Sekondi Takoradi, the Public Health Laboratory in Tamale, the War Memorial Hospital in Navrongo, and the Cape Coast Teaching Hospital, so they can also use PCR technology. We are recalibrating 100 regional and district tuberculosis gene expert laboratories across the country to help ensure that we have a minimum situation of one testing center per region. This disease is new, and it is in plain evolution, and there is therefore as yet no vaccine or cure. But we know enough to take action, and we shall be nimble and adapt as the situation changes. We will tailor our solutions to our unique social, economic, and cultural conditions. There is no one-size-fits-all approach, but I pledge to you the government will do whatever is required in our particular circumstances to safeguard the lives of our people and keep our economy going. Discipline, self-discipline, is that strong bridge that all of us, from the safety of our homes, in our workplaces, and in our communities, must build. We need to build a strong bridge of self-discipline in order for us to cross over from this difficult period of restrictions and the spread of the coronavirus to the other side, where total freedom to go about our normal lives awaits us. To defeat the virus and get there, we have to accept that we have to wash our hands, maintain good hygiene, refrain from shaking hands, wear our masks, and practice social discipline in all of our engagements. Fellow Ghanaians, we are confronting one of the greatest challenges of our generation. We have to win this battle. We have to defeat the virus. It is our behavior and response that will determine that. I have every confidence that collectively, we Ghanaians have it in us to rise to the occasion and become victorious. I'm very grateful for the great support you have given my government and I as we steer our country out of this crisis. Continue in unity to provide that support. This too shall pass.
The president made it clear that they have also understood the way the virus is working. They are not depending on the World Health Organization. They have to rely on their own data generated. In other words, they are not working with the predictive one. They are working with the original data on ground. And based on that original data, Ghana has to open for business starting from tomorrow, April 20th. This is what we are calling on every African president to do. Use original data. We have some of the finest men and women in the medical profession. These guys are sought after all over the world. Let them go on the ground and generate data just like Ghana did. They can get the data. Tell us, how is the virus behaving in your own country? Check it, get the data, and based on the data you get, use that to decide what to do with your nation. Do not lock your nation down because somebody predicted there will be 500,000 deaths in the next 2 months, or because somebody is predicting there's going to be 10 million deaths in the next 3 months. No, use the data that you can generate by yourself to decide whether to continue to lock down or to lift the lockdown, which is what Ghana has now shown leadership in doing by lifting it partially. And of course, as soon as they have lifted partially, it's going to continue to happen that way until it gets everywhere in the country. And I want to say a very big thank you to you, President Nana Akufo-Addo. You are a man of your words. You are a man of action. I know that you are a great president. And what you have done is you have now shown a strong leadership. You have lifted the cloud of fear over the citizens of Africa, not just Ghanaians alone. Do you know what you have just done? You have given life to so many people in Africa. And we will never forget you for this. And you have to be specially rewarded for what you have done today. We are now calling on all the other presidents across Africa to toe the path of the Ghanaian president. If data could be generated by Ghanaian doctors, why can't it be generated by Nigerian doctors, by Ethiopian doctors, by Kenyan doctors, by South African doctors, so that Africa is opened up for business again? This man is thinking about the suffering people of Ghana. Everybody should do this. And this is to say that we are about to be open for business. God has answered our prayers. Congratulations, Republic of Ghana. Congratulations, Nana Akufo-Addo. We are with you. God bless you real good.